Welcome to QD Clinic. Hi, I'm Dr. Jack Cush with Room Now. Room Now is going to cover the ACR convergence meeting. Convergence, isn't that what they're calling it? Today's case is really about I'm not stupid. I keep telling myself that, I'm not stupid. The case that made me think this, a 29-year-old gal is hospitalized for about 2 weeks. This is a number of months ago. She was hospitalized with some general malaise, not feeling good, fevers around 100, 101, not necessarily predictable. She lost about 10 pounds in weight. On admission to the hospital, she really didn't have bad labs, mild elevations of LFTs, mild sed rate increase. But chest x-ray showed widening of the mediastinum. She had a mediastinal mass, actually a sort of para-aortic mediastinal mass. And as you can imagine, a big workup ensues by the infectious disease division and the rheumatology division. So, plethora labs and the ANA 1000s all come back, all test negative. Imaging shows some interesting results. She, on PET CT, had some increased signal in her parotids, although there was no parotid symptoms nor parotid swelling on exam. Abdominal CT showed some mild increase in the size of liver and spleen and a retrocrural node. And as you can might guess, that the consideration at this point is that the patient may have IgG4 related disease. The differential diagnosis also included a multitude of infections, sarcoidosis, TB, lymphoma. But in the end, it was felt that we needed to get a biopsy of that retro or para-aortic mass, the mediastinal mass, and that was ultimately done. The interesting thing was the patient never received any steroids, never received any interventions other than a course of antibiotics during the workup, which didn't make any difference. The patient was discharged, kind of slowly got better, and now the patient's being seen almost 6 months later. Has done very well, really has almost no symptoms, maybe some mild night sweats. Weight is good, no joint, no systemic manifestations. And the biopsy was done, actually the mass was removed and came back with fibrosing mediastinitis. So at this point, I'm thinking IgG4, right? I don't know. And I keep saying, you could be stupid on this one. I know about IgG4. I've read about it. I've written about it. I almost diagnosed it in 2 or 3 people. They didn't have it in the end. And I'm now in a teaching clinic with a resident going over this case thinking, all right, we have, I think, enough evidence to make the diagnosis, but do we? And do we treat? And you know what? I'm not stupid. And you know why I'm not stupid? Because I'm surrounded by peers and trainees. In the clinic, we had 2 attendings, we had 3 fellows, 2 residents, 2 medical students, and I just say, hey, Dr. B, we got this case. I give him the quick rundown and ask him, what do you think? And what was great about this whole exercise was it turned into a discussion that involved everyone. Even though everyone's seeing their own patients, taking care of their own case, everyone gets sucked into this conversation because it's really interesting. Is this really, IgG4? How are we going to better make the disease? Were there IgG4 cells in the biopsy? Yes, there were. How many? Well, didn't say. What was the ratio of IgG4 to IgG cells? We are actually lacking some information we need to really be totally complete here. But fibrosing mediastinitis is not an uncommon subset within this group. And the question is, are we going to treat? So what I am presenting here is partly an IgG4 related story, but also I think the wonders of working with others, the wonders of working in a teaching clinic with trainees, the wonders of working alongside your peers, because when you're feeling the least bit stupid, they can remind you, hey, you're not so stupid, and they can educate you, just as you may educate them. So the great thing about this is, I know I'm good at what I do, but I know I'm not always great at what I do. But I am great when I'm surrounded by my peers I can be better when I'm surrounded by trainees. Everybody brings something to the table. And this is kind of important when considering how we're going to learn at the ACR. You know, we learn a lot when we go to these meetings because you're surrounded by peers, there's a lot of discussion and whatnot, but next month, we're going to have a virtual meeting where this is a bigger challenge. How are you going to interact? How are you going to learn from your peers? Again, I think there are many ways that you can do this. We're working on doing this at Room now. You give us 2 hours. We'll give you the meeting, and we're hoping to interact with you on that which is covered during the meeting. Tune in tomorrow for another QD Clinic.